So what types of sexual problems do women have? Well, the biggest ones are pain with sex, which is often related to dryness, to narrowing and shrinking of the vagina and the tissues of the vulva, and that also may leave a woman with a lot of soreness after she has any kind of sexual contact. Loss of desire for sex is a big one, and we'll talk about that as well. And when you're not in the mood for sex or sex hurts, it's hard to get turned on and feel pleasure during sex. And then it's doubly difficult for many women to reach an orgasm, not because the cancer treatment affects the orgasm physical process directly, but because of those indirect consequences. So if we look at the different treatments that are most common, the initial big debulking surgery in the pelvis causes the sudden loss for a younger woman of her ovarian function with the vaginal dryness, pain with sex, often severe hot flashes that may interrupt sleep. Sex with penetration may be painful because of pelvic scar tissue, or the bladder may kind of descend into the lower area of the pelvis right on top of the vagina, and that can cause pain with deep thrusting during sex. A lot of women take aromatase inhibitors, and they are just death on your sex life. I'm sorry, they're great for cancer treatment, but at least a quarter of women who are on aromatase inhibitors have such severe pain and dryness that they stop having sex completely. And not to mention the joint and bone pain, which make it uncomfortable and make you have chronic pain and fatigue, which doesn't exactly lead to being in the mood for sex. A few women who still have their ovaries may have at some point those ovaries shut down with the shots, the GnRH agonists or antagonists, often combined with an aromatase inhibitor. Now, tamoxifen has kind of gotten a bad rap when it comes to sex. Actually, tamoxifen, although it acts in breast or ovarian tissues as an anti-estrogen, actually helps a little bit with vaginal lubrication. And although it can cause some hot flashes, a lot of women who are premenopausal don't go into a full menopause on tamoxifen, but may just have some irregularity in their menstrual cycles. We know very little about the impact of targeted therapies on sexual function. The immune checkpoint inhibitors do seem to be able to affect hormone production, but it hasn't been well studied. But they do have side effects of fatigue, nausea, and diarrhea, which again, indirectly, can interfere with sex. So just related to menopause, when women go through menopause and have very little circulating estrogen, which is even more so if you're taking anti-estrogenic drugs, there is a loss of vaginal lubrication with sexual excitement. Some is produced, but it's slower and less is produced. There can be a loss of the stretchiness of the vaginal walls, which makes the vagina feel tight and dry. When a woman does have sexual activity after menopause, she may be at higher risk to get bacterial vaginal infections or bacterial urinary tract infections because of inflammation and the friction from the sexual activity and the bacteria washing up into the bladder, And also, pain with penetration can lead women to tense the muscles of their pelvic floor without realizing it, and that makes the pain worse, and we'll talk about that. Any woman who has experienced pain with sex on multiple occasions knows that it can really mess up your desire for sex, because who looks forward to getting turned on and starting to have sex only to find it's painful? And also, the insomnia and fatigue reduce women's desire.